All right. Okay, so thank you. Good afternoon, everyone. And of course, thank you so much to Innovizon Creative Solutions for the invitation to be here with you today. Thank you, Doctors Atento and Quinto, no, for inviting me as well. I'm glad to be here with you. I heard that you are nursing, pharmacy, rad tech, and med tech students. Am I correct? Can you give me a heart if you belong to any of those courses mentioned? Okay, thank you. Thank you so much. Ayan. So we're going to be together for a few hours. You have no choice, okay? But we're going to be discussing about something really important in the profession, no, that we all share, but is often neglected or disregarded, let's say, because it cannot really be seen. It's not something so obvious, right? Mental health, when you discuss about it, or when you actually have problems in it regarding it, no, it's not something so apparent. Di mo siya makikita kaagad. So sometimes it's just put aside. Okay, so we'll be talking about managing patients' mental health. Okay, so let's go. Yan. So we all know this, no? Physical fitness, physical health, and mental health, they actually work hand in hand. They should be together. No, we both need the two of them for optimum health. Okay, so we need physical fitness, we need physical health so that we can be strong physically, and then we also need mental fitness so that we can sustain a good state of mental health. So given that, and I'm sure you already know that that's too obvious for you, can you use your chat box and let me know which of the two could be correct? No, is it letter A, physical health is greater than mental health? No, if you weigh things out, what do you think? Is it physical health greater than mental health, or is it letter B, mental health should be greater than physical health? So please use the chat box. No, if you're quite shy, you can send it to me directly. Okay, type A in the chat box if you think physical health should be given more importance, and type B if it's mental health for you. Okay, I've started receiving. Thank you very much. You're here. Ayan, may mga hearts pa. All right. Okay, so thank you. Yep. All right. Actually, it's a trick question, no? None of them should be treated better than the other. The correct equation should be this. Okay, physical health is equal, no? Is equivalent to mental health. Okay, they should be given equal priority and equal importance. Okay, in as much as you value your physical health, it should also be the same way that you value your mental health, because they work hand in hand. Whatever you feel, whatever you think of later on, it's going to start manifesting, no, physically. And whatever you feel physically, that would send a signal to your brain that it's something that you should problematize about. Okay, so it's actually connected. Okay, but it's sad because in the Philippines, much more importance is given to physical health. Tama ba? I think you would agree, right? In the Philippines, even the slightest ubo or sipon, we have the sari-sari store who could offer Neozep for us. Tama ba? If we, like, let's say, catch fever or we're experiencing hot flushes, so on and so forth, we could just phone our physician, no, and schedule a consultation, whether live or telehealth. And then we would seek for treatment for whatever that we're feeling. Okay, but if it's mental health, something that cannot be seen, something that is not too obvious, say you're feeling so down, you're feeling so demotivated, you can't even stand from your bed, you can't even force yourself to eat, no, can't even sleep, or you've been sleeping for for so long. Okay, you will just keep it in, you will just suppress it until such time na you can't bear it anymore, and that's the time you ask for help. Okay, that's the sad scenario in the Philippines right now. Okay, and it also happens especially amongst the population of patients. No, yung mental health, it's often neglected. For as long as we cure the person from the physical disease, then it's okay. Okay, but that's not really ideal, because if you think about it, no, a good percentage of how patients recover, okay, comes from this inner push, you know, the inner push to survive, this motivation to pull through. Okay, and you couple that with the support system that they get, the kind of support that they get from their loved ones, from their family. That's actually the formula so that they can be motivated to survive. No? So if we are aware that physical health should be given equal priority as mental health and vice versa, then we can do something about it as practitioners in the healthcare system. Okay, it's as if we have done half of the tasks. Okay, so simply ang message ko for the first 4 slides is that we should value both of them. No, we should not treat, we should not leave one, by the side and just focus on the other. Okay, they should come together. Okay, so just to share with you, managing mental health among healthy individuals is challenging in itself, but it is much easier, quote unquote, if you would compare that with the mental health or managing mental health among sick individuals. Okay, especially if we're talking about patients who might be having, say, chronic illnesses, terminal illnesses, serious illnesses, or maybe rare diseases, sila lang, 1 in 2 million, 1 in 200,000. For sure, as healthcare professionals in the future, you already know some of those rare disorders. You can just see them normally sa textbook, and then you finally find a patient, positive siya for it. So just imagine the emotional turmoil, the psychological turmoil. Okay, so mental health among sick individuals, the management of this would always be more challenging than those na healthy. Yung may diagnosis, those like let's say CKD, may chronic kidney disease, may severe high blood pressure, yan, medyo they're feeling down, they're looking for resources, okay, so on and so forth. Please excuse the noise at home. I hope it's okay. Ayan. So just to further share, in my practice, in psych, if someone comes to me and tells me that he might be having anxiety, some concerns with psych, psych related, 90% of the time we can manage through these things that you see on your slide. Okay, relaxation techniques, mindfulness techniques, breathing exercises. 90% of the time, they don't even need medications. They don't need referrals for medications. Okay, or sometimes what they need is just an additional activity to their routine. We call that activity programming or activity scheduling. Okay, sometimes we just advise for, let's say, physical activity, exercise, more community outings, and it's already helpful for them. Okay, but it's different kapag ka merong sakit. Okay, it's different if it's a patient who's in the hospital. It's different if it's a patient that you have to, you have to deal with bedridden sa bahay. Okay, so on and so forth. Okay, it's different doon sa mga nakahiga sa banig ng karamdaman, so to speak, because they have other things to think of. They have pains, they have physical pains, they have resources, they're looking for resources. Sabi ko nga kanina, the only source of health, benefit dito sa Philippines, PhilHealth lang, unless otherwise you have, like, let's say HMO covered siya, pero very selective din lang yun, okay, so yun, those things would add up to the difficulty kung paano i-manage yung mental health ng mga may sakit over those who are actually healthy. Lalo pa pagka hindi mo alam where pain is coming from, they couldn't detect, pina 2D echo ka na, pina PSA ka na, pina-Chem 12 ka na, normal naman yung levels, but still, you're feeling malaise, you're feeling all sorts of things, okay? So that could add up to the stress of the patients. Okay, actually, I have prepared a slide, to discuss the sources of stress for our patients, Where are the stresses of our patients coming from? I have listed here 11 for you, starting off first with the most obvious, And I've been saying this since a few minutes back. This is physical pain. Okay, malamang sa malamang yung patients natin, they're also dealing with physical pain brought about by the diagnosis. Okay, so sometimes there would be like abdominal pain. Yun pala, they're reeling from appendicitis. Of course, that would stress them out. Let's say it's visceral pain. You can't even pinpoint alin yung masakit. I'm sure the nursing students here would know kung ano yung visceral pain. Basta po sa tiyan. Pag tinanong mo, saan po masakit? Basta po sa tiyan. Pag tinanong mo, saan banda sa tiyan? They can't even pinpoint specifically. Why? Because it's visceral pain, no? You know, so those things could stress out our patients, of course. Yun ngang makat mo lang shorter than usual, yung nails mo, it could bother you for some time until such time that it's already growing, no? Getting back to normal. Okay, so how much more if it's something na namimilipit ka sa sakit, no? Abdominal pain, yun pala, it's an ovarian cyst. Okay, it has to be removed from you. So that's actually a formula for stressing our patients out. Okay, second is worries and uncertainties about the future. So you were given this diagnosis. Okay, now because of that condition, you don't know what's gonna happen to you. You don't know if you're still gonna live for 2 years, 7 years, 5 years. Okay, what's gonna happen to your family? You're the breadwinner. What should you do? Does this mean you have to stop working? Okay, so that's actually a stressor for patients. Sometimes nga may mga patients, they're more worried about what's gonna happen to the people around them instead of what's gonna happen to them. Like, paano yung mga maiiwan ko if ever lumala to, you know, things like that. Who's gonna help them out? Okay. And the more that they think about this is overthinking, the more that it stresses them out and it adds to the weight that they already carry alongside with the diagnosis, diba? So uncertainties about the future, of course, is a stressor. Okay. Now, you know your diagnosis, okay, and then you're given a bad prognosis, number 3. Okay, that's also a great stressor on the part of the patient. You're given a bad prognosis, you only have this much length, okay, or you have this long, but okay, there are certain things that you cannot perform anymore. There would be limited motions, restricted motions, limited movements, activities. You used to enjoy jogging, working out. Now you can't even lift. No, it's bad for you to be lifting heavy stuff. Okay, so that will affect, of course, somebody, especially yung mga independent patients, no, that could affect how they view themselves. So it can dampen their spirit. All right, number 4, concerns related to resources or the lack thereof. I put it here, especially since we're living in the Philippines. No, if I may share with you, because I also work for it's a psych organization / disability organization in Australia, and to share with you, medyo naawa ko sa Philippines, no, because of the kind of services that they offer there. Would you believe that in case a patient or a client that we have could be showing aggressive behaviors, halimbawa sinasaktan niya yung mga nurses, yung mga support workers, okay, the therapy or the behavioral strategies, management for that aggression, for that aggressive behavior, it's covered by their NDIS. It's subsidized, no? Pwede silang mag-seek ng therapy just to treat that behavior, just to manage that behavior. So something as, I'm not gonna say trivial, but something as simple as aggression, they could release like some 9,000 to 10,000 Australian dollars so that they can be, you know, they can be free from aggression. But in the Philippines, meron ka ng cancer, nagkaroon na ng complications, okay, you still have to knock on congressmen's and, you know, governors, mayors, offices just to ask for even 1,000 or 5,000. So imagine meron ka ng diagnosis, meron ka ng physical pain, okay, you're worried about your family, and then you still don't have money. Okay, you're asked to buy this medication, ang haba-haba ng reseta ni doc. Okay, you're given a lab request, ang daming kailangang ipagawa, and yet you don't have the money for it. This is really, you know, a difficult situation. It's a good formula for stressing a patient out, really. Okay, it's enough to demotivate a patient to survive. Okay, and that's what we're trying to avoid, right? Next is absent or insufficient support system. This happens especially among the elderlies. Yes, they could have children, but their children are also busy living their own lives, studying probably, or probably working abroad, far from the elderly parent. So when the elderly parent would catch an illness, ayan na, no, they would have to hire somebody for the day so that the parent could be accompanied to the doctor for checkup. They would have to hire people to be with the elderly parent in the hospital. Okay. And, presence is psychological. If we feel that nobody is there with us, it could somehow dampen the spirit. So how much more if you're a patient? Okay. So this can also affect, no, and serve as a stressor for our patients. Sixth is unfamiliarity with the procedures. This is where I think, no, I really believe that especially the nurses, the rad techs, no, and the med techs would come in, because some of the procedures that you witness or you actually conduct would have to be unfamiliar for your patients. They might be doing it for the first time. So it could actually help if somehow you would offer information about such procedure, no? Especially what to expect after, what to expect during. Okay. Halimbawa, there's somebody who would have to go through CT scan for the first time, and you just tell the patient, you just have to lie down there, be still, no? Don't do anything else. Of course, yung expectations niya hindi nasagot. Okay, some of the questions about the procedures hindi na clarify, so on and so forth. So that could add to the anxiety of the patient. Remember, in psych, when we say anxiety, it's about something to happen in the future. Okay, normally we call it depression if it's reeling in the past. Okay, kapag ka past, depression, pagka in the future, it's anxiety. And procedures, normally they are to happen still, so it's anxiety that they have to bear. Okay, next is decline. Therefore, inability to perform normal tasks and roles. Okay, so there are some illnesses that would entail decline. They won't be able to do what they are used to doing. Okay, yung kanilang jobs, they can't even attend to anymore. Even their 30-minute jogging, 30-minute walking, okay? And that can affect, of course, the self-esteem of the individual. All right? So we also have to watch out, no, and make sure that we have alternatives. If they can't get the self-esteem from doing the things that they used to do, then of course we can offer alternative behaviors, replacement behaviors, so that meron silang pagkukunan ng self-esteem. You could discover things, no, that could give them the same feeling, no, the same feeling of pride upon themselves. Okay. Of course, this has to be based on what they're allowed to do, yung ability nila as of the moment. Okay, if they're not allowed to walk, okay, maybe you can discover artworks, no, so on and so forth. Okay, so adjustment with meals. This could also be a stressor for patients. We all have our favorite food, I guess. Okay, mine is sinigang. All right, so there are instances wherein because of our diagnosis, because of our condition, we would be limited. We don't know anymore, no, if we could ever eat the meal again, or if ever we can, very limited, not as what we used to enjoy, no, as before. And sometimes this is not the cause of depression, of course, no, but this can actually demotivate a person. This could make them feel low, and this is a reminder that I'm not as strong as before. Okay, so adjustment with meals, this could stress our patients out. This is especially applicable if you're diagnosed to be diabetic, no? May mga type 2 diabetes mellitus sa mga patients natin, and then they have to start, adjusting their meals now. They can't even have 2 cups of rice anymore. They have to deal with half a cup, if not 1 cup. Okay, kailangan ng medyo matinding support system in that case, and somebody to also remind them, no, that they shouldn't be touching, shouldn't be eating things that are bad for them. Okay, yeah. Then sleep disruptions, no. If I may share with you, but I guess this is something that you already know. The best formula to lose it psychologically, mentally, is actually the lack of sleep. You can lose meals, you can skip meals, you can skip drinking water, no, you can lose your shelter, you'd still be okay. But if you keep on losing and losing sleep, no, over a certain period of time, let's say 5 days, 1 week ka na hindi okay yung sleep mo, okay, your psychological capacity, your cognitive capacity would have to suffer. Okay, so sure na sure yan pagka sleep disruptions. And normally, if we have patients, let's say they're admitted in the hospital, we can't help but disrupt their sleeps, no? Their sleep rather, especially mga nurses dito in the future. Okay, we will have to take their blood pressure. We would have to give them their medication. So we have to disrupt the sleep of the person. So this can actually stress them out, no, as patients. So even at home, if the person is actually staying at home, nagre-rest siya sa bahay, and we have to give them medication, we have to monitor the BP. Okay, this is different from how they used to enjoy, you know, an 8-hour uninterrupted sleep, 6-hour uninterrupted sleep, so on and so forth. Okay, next is ito. This is a big blow to the mental health of patients, especially yung mga newly diagnosed. It's the loss of independence. They cannot do as they used to. They cannot perform as they used to before. Even the most dependent person would not like the support being given to some of the patients that we have, because even to the cleaning of oneself, no, they can't function anymore. And this is a big blow to the self-esteem of the individual. Okay. Imagine somebody would have to clean after you, no, after you have gone. Somebody to clean after you have peed and pooped. Okay, so this could really have an effect on the person's psychological makeup. Okay, and of course, lack of information, because we're not ready, no, we're unfamiliar with the procedures, we're unfamiliar with how is to be done, what is to be done. We're not given the complete information by our physicians. We don't know what to expect. All right, then this, you know, puts us at a loss, no? San ba tayo? Ano ba mangyayari? So on and so forth. Okay, so all these 11 I have listed here as the primary stressors for our patients, no? So, you know, given all this, given that we know this, okay, it's good, because then we would know how to take care of our patients better, no, in consideration of their mental health. May physical pain pala. So maybe sometimes we need to stabilize the patient first before we actually do some other things with them, okay, because otherwise they won't even be able to listen to us, no, they won't even be able to understand us better because they're reeling from the physical pain. Okay, so they have uncertainties about the future. Maybe I can share some of the information I have about the diagnosis, about the disease, okay, so that hopefully we can answer some of the agam-agams of the patient. Okay, anyway, we'll go to that later, what we can do, okay, because I have prepared a different slide for it. All right, so anyway, these are the causes of stress, no, of our patients, and it's good that we are acquainted with them so that we would know how to address them. Okay, now at this point I want to ask, who's the most important person in your life? Okay, feel free to answer in the chat box, no? I think some of you may be answering mommy, my mom, my dad, okay, maybe my special someone, maybe my sibling, my only sibling, okay, I consider him or her the most important person in my life, okay. Now, you might be wondering why I'm asking this really personal question, no? I'm asking because how you will take care of him or her being the most important person in your life is actually a good reference of how it's best to take care of our would-be patients in the future, no? How we want our loved ones to be taken care of by others, okay, is how we should take care of our patients too. That's what we want. Okay, so that's how you should put a face or a name on the patient. No, we're treating not just the illness. We're treating a human person. The person has a name, the person has a face, the person has family to come home to. Okay, so it is but right that we give them the best support and the best kumbaga holistic no kind of support that we can while they're under our care. Okay, I'm not saying we should blur the professional lines, no, we should blur the lines of professionalism, but our support, no, us going or extending beyond what we should do can actually go a really long way. Okay, so what can we do given that we know those 11 stressors of our patients? So what are some of the things that we can do kaya so that we can somehow help in making sure that our patients are taken care of and that they are of sound mental health as we go along their hospitalization, as we go along their procedures. Okay, so number one, we can start with providing correct and enough information. So I'm stressing out on correct and enough. Okay, and as you can see, it's not complete, it's not something else, no, it's not another adjective, because we fear naman that you would bypass the physician himself, no? So at this point, it's enough that we provide correct and enough information. So what you just believe to be the general application, you can share with the patient or your client, no? So those things, we could limit ourselves to the correctness and yeah, pagka enough nung information that we would give our patients. Okay, number two, explaining procedures and possible side effects. In case halimbawa alam natin that the patient would be drinking this medication, would be taking this medication, and we know that one of the possible side effects is headache, we can actually volunteer that information. Ito po sir, ito po tatay, ito po nanay, pwede pong mag-cause ng headache. So maganda po siguro in the coming minutes after you have taken this, higa lang po sila para hindi po tayo masyadong maliyo, so on and so forth. So explain procedures and possible side effects whenever possible. Okay. You can go on asking, volunteer ka na. First time po bang magpapa-Chem 12 for our medtech students here, no? First time po bang magpapa-PSA? Ayan, prostate test. Okay, so first time po ba? First time po ba na makukuhanan ng dugo? Those things, you can strike up a conversation with the patient so that they can get comfortable. Okay, talking is cathartic. Okay, familiar ba sila sa catharsis, mga anak? Sino dito yung may alam kung anong ibig sabihin ng catharsis? Okay, I have typed it in our chat box. Okay. So pag sinabi natin catharsis, this is when we are relieved of something out of talking. Okay. When somebody is given the chance to talk about an experience, the person is given the chance as well to reprocess what he is going through or what has happened. And through that reprocessing, there comes healing. Okay, so the more you talk and touch base, connect with your patient, it would be helpful for them. Okay, so remember that, no? Talk therapy, actually, catharsis. Okay, if I may share with you, because back in 2016, I had an oophorectomy for my left ovary. My experience was really different. It was really nice, even though I was going through, that health challenge, as compared when I had a DNC in 2018. Okay, why? It had a lot to do with the healthcare practitioners around me. When I had the 2016, yung oophorectomy, when I had it then, the doctor, the nurses, everyone around me, they were giving me the information that I need, no? So you should, after this, you should just go home and stay at home, limit your physical activities to this and that so that you won't be bleeding as much. After 2 months, you're free to walk around again. Those things were offered to me, even the procedures that I would be going through. Okay, but when I had the DNC several years after, it was pretty straightforward, no time for explanation, so on and so forth. And now I can tell you the difference, the difference between the experiences is really big, no? And I didn't enjoy the last procedure, people around me, the explanation that they offered me. Okay, so there. Next is providing support, social support, no, providing support in general, actually. How you could touch base with your client if you know their names, no, you can call them by their first name, especially if you think same age range lang naman kayo. But since we're in the Philippines and you think the person is older, okay, you can actually call them kuya, then followed by the name, ate, followed by the name, or if they're much older, you think, then tay or nanay, followed by their names. Okay, it's a good way to connect with them. It's like making the care personal. Okay, it's personalizing it. So that's actually gonna be helpful. Okay. And that doesn't just apply in the healthcare system, no? Hindi lang sa patients nyo. Pretty soon, you'll be interviewed for your practicum. Maybe people in your schools right now, you can actually address them by their first names, no? Yung mga ka-age range nyo, or make sure that after your salutation, you follow it by their first name. It would really bridge that gap, no? It's as if connecting you instantly. All right. Number 4, you can do some relaxation techniques, breathing exercises, no? Especially yung mga nurses natin, mga rad techs, nursing, rad tech, and med tech students natin dito, those na nagsasubject sa ating patients into procedures, you can actually prepare your clients, patients better by teaching them how to breathe properly. Okay? Sabi nila, just breathe, right? But there's actually a proper way of breathing. All right. Remember, kapag nagkakaroon tayo ng anxiety, our breathing is actually different, no? Much more air is trapped in the lungs. It can actually go out. Pero the feeling that it sends is that we can't breathe. Actually, we can breathe, but the more air is trapped in our lungs. This can be explained in respiratory physiology. Okay, but anyway, so what we can do is to actually fake proper breathing, thereby sending signals to the brain that we're actually calm. So some of the things that we can do, nandito sa slide natin, is to teach our patient how to box breathe. No, it's called box breathing because remember the box has 4 sides. Okay, so since it's 4 sides, you can make the patient inhale for 4 seconds, hold it for 4 seconds, exhale for 4 seconds, and then another hold for another 4 seconds. And you repeat the process until the patient is breathing normally or is feeling more calm. Okay, so this is very simple, but this is being taught, especially in Western countries, no? Emotional literacy. This is actually part of emotional literacy, thereby, being under emotional regulation, to be specific. So we can do this. We can teach our patients, halimbawa medyo nag-a-anxious siya before phlebotomy, before blood extraction. Ayan, sige po, box breathe po tayo. Pwede mong sabayan, no? Bibilang ka, sabayan mo siya, no? For nursing students, yung mga future nurses natin, halimbawa may tuturukan ka, no? Meron kang lalagyan ng IV. Ayan, you can also do the box breathing technique. Okay. Ayan. May iba't iba siyang version, pero ito kasi yung pinakang madaling tandaan. Okay, there are other ways how to properly breathe. Pero ito yung medyo madaling ituro. Kahit sa bata, we can teach this because they, more often than not, they can actually recognize a square or a box already. Okay. Now, if you are given much more time with the patient and the box breathing is not working, there are other options. We have the mindfulness technique, no? Mag-undergo ng CT scan, mag-undergo ng 2D echo, medyo kinakabahan than usual, medyo irritated yung blood pressure. Okay? So baka mas kailangan ng mas intensive na technique and not just box breathing, we can do the mindfulness technique. So that's actually 5, 4, 3, 2, 1 mindfulness technique. When we say 5, 4, 3, 2, 1, it means 5 things. The patient, you can ask the patient to name 5 things that he can see around him. Okay, it's actually a way of diverting the focus, no? Diverting the concentration of the person. But this really helps, I'm telling you. Mapabata, mapamatanda, no? The mindfulness technique really works. Okay, so going back, 5 things that you can see. Sige po tatay, name po kayo ng 5 bagay na nakikita niyo po ngayon. So, name siya. Pwedeng in your case, no? You can see the laptop, you can see the aircon in your house, you can see your door, you can see your notebook and your pen. Okay. Yung 4, you can ask the person to name 4 things that he or she can feel. Okay, 4 things that he or she can feel. So, pwedeng the table under my arms, I can feel it. The floor, no, under my feet, I can feel it right now. The chair that I'm sitting on, I can feel it. And last one, I can feel the breeze of the aircon. Ayan. For number 3, you can ask the person to name 3 things that they can hear. Okay, so what are the 3 things that you can hear right now? Probably my irritating voice, number 1. You can hear your aircon blowing. Or probably you can hear our chickens outside as well, no? Trying to duet with me. Trying to, yan na. Trying to speak alongside me. Okay? Number 2, diba 5, 4, 3, 2, 1 siya. 2 things, you can ask the patient to name 2 things that he or she can smell. Alright, so what can you smell po ngayon? Sige nga, name po kayo ng 2, sir. Ayan. So, if in case wala, kasi wala talaga siyang maamoy, walang present na or prominent na amoy around you, then you can ask the person to just imagine. What's your favorite perfume po? Try nyo pong imaginein na inaamoy po siya right now. Or maybe favorite food. Ano po yung amoy ng paborito nyong pagkain? Ano po ba yung paborito nyong pagkain? Sasabihin niya adobo, halimbawa. So sige nga po, imagine niyo nga po na inaamoy niyo ngayon yung bowl of adobo. Okay. So number 1, 5, 4, 3, 2, 1, diba? Last one is name the last sensory, diba? Name 1 thing that you can taste. Now, if the person is not eating, is not just done with eating, no? So, pwedeng mag-imagine favorite food niya na kinakain or some, you know, kahit di favorite, something that he or she is eating. So, 5, 4, 3, 2, 1. It's a 3 minutes, 2 minutes of diversion. So, instead of the client or the patient focusing on the anxiety or the tension brought about by the conducts or would-be conduct of the procedures, they can focus on the 5, 4, 3, 2, 1 you're asking them to do. Okay, and then number 5, this is something that I have shared a while ago because talking is cathartic, remember, so we could offer to them our listening, no? We can offer them our time. If they have some complaints, no, about how they feel, if they're expressing to you their worries as regards their diagnosis or would-be diagnosis, no, yung kanilang state ng body nila at as of the moment, then be open. Okay? Huwag tayong maging yung medyo Western yung approach. That's why our professionals are known all over the world for having that personal touch. No? Sana wag mawala. Okay? Kasi yung mga Westerns, pagka-check, tapos na. Pagkakuha ng blood, wala na. There's not even any connection. So in our case, I hope we make it more personalized so we can take care of their mental health as well. No, some of our patients, they would have to drag themselves to the hospitals or to our diagnostic clinics just to have some procedures done. You know, they would have to be assisted, so on and so forth. It took them so much just to get there, to face you as the professional, and then you're not going beyond your services or your the expectation. So, sayang. So, bigay na natin. Ayun. So, at this point, I would like to move on to mental status examination. This is actually more applicable to the nursing students here, but it wouldn't hurt if our radtech, pharmacy, and medtech students would also know, no? Even the nurses naman, when you're already practicing, you don't even have, enough time to complete the mental status examination. But knowing their components and how they could tell about the mental status of an individual, that would help. Because normally, it's the nurses who are the first contact, di ba, of the patients. Kayo yung more often than not nakikita muna. Okay, so this is the MSE, the mental status examination. Disclaimer, meron tayong mini MSE that takes, much shorter period of time. So this one is the complete version. All right. So I know when you're already in the emergency rooms or when you're already dealing with patients, you wouldn't have enough time to complete all 15 components. But you can aspire to remember even just 2 or 3 of them, no? And when you get to face the patient, when you get to face your patients already, you could try and apply, and see if components check in or check out, as to the patient having some mental health concerns. Okay, so number 1, of course, is appearance. This is observed. Number 2 is behavior. Number 3 is attitude, which is also observed. Level of consciousness, observed. Orientation is inquired. Speech and language is observed. Mood, all the way down to intellectual functioning, because anyway, the succeeding slides, we would talk about them one by one. Simply put, what I wanted to stress out on this slide is that yung mga may observe na katabi, sabihin nun, you just have to observe, that component. You don't need to ask any question about it. All right. Now, if you could see, merong components na merong inquired na katabi, it means that you have to ask questions. You have to ask guide questions so that you would know more about such component. And then meron namang components dito, kung makikita nyo, in parentheses, observed/inquired, meaning you can both observe the behavior or the component and inquire about them. You can also ask about it. So anyway, let's go. These are actually some of the examples I have given here are real scenarios of patients and clients. No, so number 1 is appearance. This is observed. I think this is the number 1 thing that we can see. No, so you can take a look at the gait, the manner of walking. That's what we mean by gait. The posture, the clothes, and the grooming. If we see that our patients or clients might not be of very clean and good appearance, it says a lot about the mental state of the person. I'm not encouraging you to judge. I'm telling you just how important self-care is in the determination of the level of mental status of an individual. Okay? Kapag ang tao kasi merong decline in the mental state, mental health, okay, one of the first things that the person would neglect is self-care. Yan na yung nakakalimutan niyang maligo, hindi na niya kayang maligo, hindi niya na kayang kumain, hindi niya na kayang matulog, and it shows in the appearance. Okay? So try to observe the appearance of the individual. Okay, numbers 2 and 3 would be behavior and attitude. Okay, pinagsama ko siya sa isang slide because they're actually hand in hand, no? Contrary to popular belief, attitude and behavior are different from each other. When we say behavior, this is overt and this is what we can actually see. No? Ito yung mas na-observe natin at ito yung kaya natin actually i-control. When we say attitude, this is more of the mental state. Okay? Kaya if ever meron sa inyo nung, let's say, high school, okay, high school or elementary, you came home with a report card, yung grades nyo, no? You came home, you're very happy kasi sinulat ni teacher sa likod, this student has very good attitude. Tas proud na proud ka, pinakita mo kay mommy mo or kay daddy mo. And then your mommy and daddy ended up being proud as well. Okay? While it's nice okay, that it's a positive feedback, it's actually technically wrong because attitude cannot be like observed like that, no? Attitude is a mental state of mind, and how it is transformed into actions is what we call the behavior. Okay, so ang manifestation palabas ng attitude is our behavior. Therefore, it's our behavior that we can actually observe. Alright, so behavior, mannerisms, gestures, ano yung kanyang psychomotor activity, meron bang eye contact dun sa patients nyo? Okay, kasi related dito sa levels of consciousness. Okay, can they follow commands? Baka kasi they're having a hard time following commands. Pinataas mo yung kanyang, let's say, non-dominant hand para dun mo kukunan ng dugo and yet he couldn't follow. Then you can actually inspect if there is a deeper problem. Okay, you can call for an emergency in case there's a much deeper problem you could see. All right, so that's behavior and attitude. Next is level of consciousness. This is also observed. Some of the possible descriptors would be, is the patient vigilant? Is the patient alert? Tama-tama lang yung alertness niya. Or is the patient drowsy? Parang inaantok, lethargic, stuporous, asleep, comatose, confused, or it fluctuates from being conscious to not conscious, so on and so forth. Kasi this would tell about the physical health of the individual as well, no, yung level of consciousness. So it's good if we could check on this as well. Okay, orientation. So sana hindi to mawala in your choice, no, dun sa components. If you cannot conduct all 15, at least remember orientation, which is number 5. Okay, orientation, simply you check on time, person, and place. TPP. I'll type it, no, time, person, and place. Is the patient oriented when it comes to the time, when it comes to the person, and when it comes to the place? What do we mean by that? When you ask your patient, tatang, ano pong oras na ngayon sa tingin nyo? Ano pong oras na? Okay, and the patient replied that it's nighttime, whereas it's just tanghali, it's just noontime. That might say something, no, about the mental status of the person. Okay, when we say person orientation, can you ask your patient to say who is with him or her in the room? Okay, and if the patient is alluding to somebody else who is not really physically present there, then it might be a sign of a mental health decline, or there's something wrong with the mental status of the person. And place orientation, if the person cannot tell where he is, no, whereas he is in your diagnostic clinic, he is in your hospital, okay, then there might be something wrong with the mental health of the individual. But of course, be sure to check if the person is into medication, baka kasi side effect lang din. All right, so orientation, TPP, time, place, and person. Okay, 6. If there is a problem in terms of speech and language, this is something that we can observe. All right, there would be patients who would talk and talk and talk. You won't even have the time to butt in to ask your own questions. They would offer everything to you already. And then there are those who wouldn't even respond, no matter how many times you ask them. Okay, so be sure to take a look at these things as well. So speech and language can actually classified according to quantity, rate, volume, and fluency and rhythm. So for quantity, masyado bang talkative, spontaneous, tama lang, or there's paucity? When we say paucity, hindi siya nagsasalita. There's poverty of speech, no? Hindi siya masyadong nag-discuss. Okay, hindi mo talaga makausap, hindi mo makausap. Okay, so rate, is the person a fast, slow, normal, or pressured speaker? Try to check on that as well. Volume, is the volume loud, soft, monotonous, weak, or strong? Fluency and rhythm, is it slurred? Okay, kinakausap mo siya, o, Nay, kumusta po? Anong bibitihan ko lang po kayo right now, ha? How are you? Let's check. Tapos po, ipasa ko na po kayo kay ganito, ganyan. No? And while the person was sleeping, you could detect some slurred speech, no? Some slurred words. Okay. That might be indicative of a neurological concern. So mapipick up mo kaagad siya, no? So habang ginagawa mo yung physical examination, maganda na isabay mo na, i-incorporate mo itong mental status examination. Try to notice as much as you can following the components that I have presented to you. Okay? Ayan. So number 7, mood. And we inquire about mood. Okay? Because just like attitude and behavior, one of them cannot be observed outside. Mood is like the counterpart of attitude. You cannot see it. No? Kaya mali yung moody siya. Moody siya, oh, tamo ang ma-moods. Okay? Because mood is not actually something that you can see. It's the affect that you can see. No, yung mood, it's internal. It's an inner feeling. All right? So mood, you can ask, no, how do you feel right now? Kumusta po kayo ngayon? Tay, Nay, or Ate? Yeah? All right? Ayan. So now, number 8, ka-connect niya, ito na yung affect. It's like the counterpart naman ng behavior because this is what you can observe. Kailangan kung ano yung sagot niya sa question mo dito, sa mood, how are you feeling, kailangan it also manifests sa mukha niya. Okay, ako'y medyo nahihirapan ining huminga Bawa ganun ang sagot sa inyo, no? So the affect should be telling of the same thing. They have to be together. They have to be parang mag-level, no? Hindi yung magsasabi siya ng I'm having a hard time and yet the person is happy. That's inappropriate affect. Okay, it's not appropriate to the situation that she or he is in. Okay, so be fast in picking those things up. All right. So meron ding aside from inappropriate affect, meron ding blunted affect. No matter what the person is just like what Lady Gaga says, no, poker-faced, flat affect, no, yun poker-faced, or normal ba yung intensity, no? If you're talking about something serious, sumiserious siya. If you're talking about something light, then medyo nagla-lighten up din siya. So mood and affect have to come together. Remember that. This is not just something that you can apply to your patients, even to your classmates, you can apply this. Even to the people you love at home, you can apply this. There might be something different, no, between the mood and the affect. So you can actually tell. All right. Next, thought processes or thought form, no? You can both inquire and observe this component. So this is when we test the logic, the relevance, the coherence, no? When you talk to them, is the patient able to answer you logically? Okay? Merong flow, maayos na flow na na nakukuha from the discussion, from the conversation. Okay? Ayan. Because some of the possible descriptors of this component is linear, my goal, yung pinag-uusapan nyo, goal-directed, or is it tangential? Ang layo, no? Tinanong mo, kumusta ka po? Pero iba yung sagot, ang layo, no? Ay, nagluluto pa nga ng kaldereta sa bahay. Malayo yung sagot. So that might be indicative of something else. Okay? So dapat makatch nyo na yan. Alright. So example, and this actually came from an actual patient. The person asked, the practitioner asked, you mentioned you like living in the province. Anong sagot? Can you read for me? Adraneda, Mr. Donwell.
You mentioned you like living in the province. Patient answer. There is always the voice. Yes, must be adobo.
Okay, thank you very much. You think it's connected? You think it's linear, Mr. Donwell?
Hindi po. Malayo po yung answer ng patient.
All right. Very good. Thank you very much for your participation. So malayo, no, tangential tawag diyan. Walang kinalaman yung sagot niya dun sa tanong. Okay? So sometimes pag halimbawa sa ER, it might be because the person is already in distress, no? Nag-worry na or may confusion. Di ba? Mga may confusion, yung mga may toxins in the system, all right, they can't answer you properly and coherently anymore, or it might be an existing mental concern. All right. Another example po, can you read this for me? Medyo funny siya. Althea. Miss Althea Kaisip or Saisip? Sorry. Yes, yes. Okay, thank you. Medyo parang akala mo novelty song siya, no? Pero this actually came from a patient. While you're talking to the patient, this is what they're saying. Rababa, no. Red pulala is battery. It's actually an example of neologisms, no? When we say neologisms, they're making up words that don't really mean anything. Okay, so this could be indicative of a psychological or neurological problem. It could be psychosis as well. So you better pick this up, no, upon presentation of the patient. Okay, another example, Miss Alexandra Torres.
I spent the day sandpapering, paper. The table is sandpapered. After a few minutes, she is back on the topic.
Okay, thank you, Alex. I suppose you're being called Alex. Okay, so this is an example of perseveration. All right, paulit-ulit siya dun sa topic na yon. Okay, I spend the day sandpapering, paper. The table is sandpapered. If the patient or the client you see upon contact would just have one topic to discuss over and over, even across a time period, it's what we call perseveration. Okay? Ayan. So this is not just because of performance na hindi siya magaling sa speech ha, but this could have an underlying mental health concern. Okay? Ayan. So another component is thought content, which could also be inquired and observed at the same time. So some of the possible questions you can ask your patient is, what do you think about when you are sad or angry? Okay. What's been on your mind lately? Do you find yourself ruminating about things? Do you ever feel detached, removed, changed, or different from others around you? Do you see or do things seem unnatural or unreal to you? So you can actually ask these things to the person. Okay, so this is an example of a patient, 18 years old. Kindly read the statement, Miss Margaret Balungaya. Miss Margaret, are you there? Okay, it seems she's not. Let's call on Carlo Miguel Diaz. Sir Carlo?
Para pong may nagsasabi na ininom ko yung Sunrocks, kaya ibinidyo ko na yung sarili ko sa bahay. Ang alam ko hindi naman, pero parang may reply na ininom ko nga.
Okay, thank you, Sir Diaz. Okay, so this came from an actual patient, no? Para pong may nagsasabi na ininom ko yung Zonrox, kaya binibidyo na yung sarili niya sa bahay. Okay, just to be sure na hindi niya iniinom. So, parang the person can't trust herself anymore, no? That she's remembering the correct things. Okay? Another thing. Okay, you can ask, do you ever see, hear, smell, taste, and feel things that are not there, such as voices or visions? Okay, and next components would be suicidality and homicidality. Okay, so when we say suicidality, these are some of your possible questions for your patient. Do you ever feel that life isn't worth living? No, that you would just soon be dead? In UST, no, di ba may hospital in UST? Okay, there's actually parang ward for those na may mental health concerns as well, the patients. So, yun, may mga rooms specially for them. So, I think this is where you might really be asking suicidality and homicidality questions. But if it's a patient who's coming in because of abdominal pain, because of chest pains, you don't go on, asking these questions anymore. Okay, if upon presentation the patient is looking like may mga slits sa wrists, no, fresh or that's the time that you can ask these questions. Otherwise, leave them out. Okay, but anyway, for homicidality, the possible questions could be, do you think about hurting others or getting even with people who have wronged you? Have you had desires to hurt others? If so, how? Okay. So anyway, I wanted to also show some actual statements from actual patients, from real patients, no? Ito yung sinasabi nila. This one, merong suicidal ideation talaga to. Okay? Pinapatabi ko po yung mga bleach sa bahay at kutsilyo kasi nakikita ko sarili kong sinasaksak ko yung mommy ko. Yung mga pamangkin ko po, gusto ko pong sakalin kasi baby pa, so they had to be moved someplace else. The babies had to be moved someplace else. All right? Ayan. So number 12 is you can also inquire and observe about your patient's insight and judgment. So what brings you here today and what seems to be the problem? Okay. But normally, if it's an actual patient in the emergency room, may kasama, no? Mas madalas may kasama, and it's normally the chaperone who would be answering for you. If the person is conscious, you could still ask these questions. Try to find it out from the person himself and see if the person has insight or judgment as to his condition. All right, and they could self-report to you what they're going through as well. Okay. Next, number 13 is attention, inquired and observed. No, possible descriptors is the person attentive, concentrated, or distracted. You can put up your hands, in front of your patient and ask them to, let's say you put up 4 fingers. Ask them to count 1 by 1 from left to right, right to left, or ask them how many they can see so that you can check their level of attention. You can also ask them to memorize a series of numbers. Let's say give them 3 numbers, 9, 6, 5. I'm going to say three numbers to you. I hope you can repeat them to me. 9, 6, 5. And then the patient should be able to say 9, 6, 5 back. Now, can you do that backwards? So from 965, it would be 569. If they're able to, then no problem. The attention is okay. The orientation is okay. But if they can't, they're having some concerns. Ayan na. Might be neurological concern. No, it might be something affecting their level of consciousness as well. Then you can report your physical observation, your mental status examination. Okay, so there are many variations to this. It would just depend to you, pero na wag lang quiz B levels, no? Wag naman masyadong mahirap yung itatanong nyo. Okay, it can just be some 3 numbered series or spelling backwards. Okay, meron pa niyan actually. Yan, simple calculations just so you can check the patient's orientation and attention. Okay. You can also inquire about the patient's memory, recent memory being, what is my name? Being your nurse, what is my name? Being your med tech today. Okay, you can actually ask that. What medications have you taken today? Do you remember? Okay, so you can check on the person's memory. Now, when we say remote memory, these are the possible questions for your patient. Where were you when the martial law happened, assuming that the patient was already alive then? Okay, can you dictate to me your cell phone number, please? Ayan. Okay, so when and where did you get married po? Sino po yung kasama nila? Si mami po. Okay, si wife niyo po. Yan. Pagka medyo matagal na, you can actually inquire about memory and ask, saan po kayo nagkakilala? It's not being, trespassing. Okay, it's actually you having a reason for asking such question, and that is to test the memory. All right. Immediate memory, some of the possible questions or activities or instructions would be, I'm going to ask you to remember 3 words: color, object, and animal. Example, blue, table, and horse. And then I would be asking you back after 5 minutes. I hope you'll be able to repeat them to me. Okay, so yeah. After 5 minutes, what are those 3 words that I asked you to remember? Okay, so you have to monitor the accuracy of response. Kung tama ba yung responses niya, tama ba yung sequence, or nagpalit-palit ba siya ng words, may naibang syllables, okay? Those things, no, you should be able to catch. And yeah, number 15 is intellectual. This was just recently added, actually. This can be inquired and observed. So you can take a look at the person's information and vocabulary. No, you can ask for the, let's see, can you name 3 senators for me? Ayan. So what's the capital of this, just to check on the person's level of intellect. You can also observe the patient's abstraction. Some of the possible questions would be, how are the following items similar? Yeah, an apple and an orange. Ano pong pagkakatulad sa apple and orange? Ayan, sabihin sa'yo, fruit. Okay, so tama. Chair and table. Pareho pong furniture. Pareho pong gawa sa wood. Okay. Ayan. Alright, so this is a sample of an actual MSE. Okay, this is the full thing. All right, but since your profession would not require for you to write the whole thing, just for you to remember at least 3 things, no, 2 or 3 things that I have listed a while ago. Okay, you don't really have to write this much, no, this length, but at least you should know how it is actually applied. All right, so can you read the first sentence for me? Miss Centino, Sahara. Miss Sahara. Ganda ng name nyo, Sahara Brookshield. Okay, sige, wala. Cherilyn, answer niento. First sentence lang po.
Gary D., a 48-year-old white male, was disheveled and unkempt on a presentation to the hospital emergency room.
Thank you. Thank you so much. So si Gary D, yung patient, no? Nagather mo na 48 years old siya. Okay? He was disheveled and unkempt. So this is talking about the person's appearance. So parang hindi siya naligo. Parang hindi siya nag-prepare. And nandun siya ngayon sa hospital emergency room. Can you read the next sentence, Miss Winette Pemano?
He was wearing dirty khaki pants, an unbuttoned golf shirt, and white shoes, and appeared slightly younger than his stated age.
Ayan, thank you. So, yeah, no, this is also more about the person's appearance. This is the clothing. Okay? Next sentence, Frederick Kua. Mr. Kua?
During the interview, he was agitated and restless, frequently changing seats.
Okay, thank you very much. So during your testing, yung pagtatanong nyo, mental status examination, no, he was agitated and restless. So this is behavior, right? Because you can easily pinpoint, you can see it. Okay, hindi siya mapakli, palipat-lipat siya ng upuan. All right, next sentence, Mr. Sana Mr. siya, JTD.
Yes po.
Okay.
Mr. D, tama po.
Yung first sentence, bunso, before that. Thank you.
During the interview,
He was impatient.
I'm sorry. Okay. He was He was impatient and sometimes rude in his interactions with this examiner.
Okay, thank you. So he was impatient and sometimes rude. So this is, again, more about the person's behavior. So of course, before he acts upon it, it started from the person's attitude. Tatandaan yun ha. If there are instances wherein nagbe-behave kayo and it's not what you actually feel inside, it's a phenomenon that we call cognitive dissonance. Layman's term, parang plastica with what you're really feeling. Okay? But with people who are having some mental health concerns, normally magka-attach yung attitude and behavior nila. Kung ano yung naiisip nila, yun din yung ina-act nila. Kaya minsan, sorry for the term, wala silang pakundangan. Okay? So in this case, yan. He was impatient and sometimes rude. Basto siya, no, in the interactions. Okay, thank you, Mr. D. Next, Miss Karil Abuan. Next sentence po.
Mr. D reported that today was the best day of his life because he had decided to join the professional golf circuit.
Okay, very good. This is the best day of my life. I joined the professional golf circuit. Okay, mga ka-level ko na, sina Tiger Woods, professional golf. Diba? I'm playing. Okay, yung mga well-known. But if you would actually check, wala naman talaga siya doon. Alright? Ayan. So, Miss Christiana Batakan. Ganda ng name niya. Okay. Miss Batakan, are you there? Sige, wala. Miss Kyla. Kyla Perez.
His effect was legible but appropriate to the content of speech. He became cheerful when reporting he had more data number.
Okay, thank you. So his affect was labile. Paiba-iba yung emotional expression niya, yung facial expression niya, no? So, pero kapag ka pinag-usapan yung actually imagination niya lang to, no, naka-bogey siya number 15, ibig sabihin naka-shoot siya sa golf, no, with just one swing. All right? Medyo mangiyak-ngiyak siya. So it's actually appropriate to what he was telling. But what's questionable here is what he was reporting, if it's actually accurate. All right? Thank you, Miss Kyla. Next, Miss another Kyla. Kyla Tutaan.
His speech was loud, pressured, and over-elaborative.
Okay, thank you. Yun na, dito na tayo sa speech and language, right? The speech was loud, pressured, and over-elaborative. You're just asking about one thing, he goes on and on. He expounds unnecessarily. Okay? So far ba may idea kayo if the person has good mental standing, good mental capacity? With just the first few items, no, somehow you're getting an idea that he's not. Okay? Next, Miss Lay Lat. Or Iyat. Okay, yes, ma'am. She has unmuted actually. Okay, maybe having some problems technically. Sige. Miss Leslie Maika Ferese? Okay. Okay. Yeah. Please read the next one. Thank you.
He exhibited loosening of associations and flight of ideas. He intermittently and unpredictably shifted the topic of conversation from golf to the mating habits of geese to the likelihood of extraterrestrial life.
Okay, thank you, Miss Felice. Ayan. So, dito naman, loosening of associations, walang kinalaman sa topic yung kanyang mga pinagsasasabi. There's flight of ideas. All right. He shifts the topic from golf to mating of geese, just like that, no? And to the likelihood of aliens, diba? Of ETs. Ayan. So, next, Miss Lovely Declaro.
Mr. D described grandiose delusions regarding his sexual and athletic performance.
Okay, thank you, dear. So he was boasting about his sexual and athletic performance. I'm very good in sports. I'm also very good in bed. Okay. And next, Miss Maria Trinidad, saludo. Okay, sige, let's just call on Miss Matignas, Nicole. Okay, so he reported auditory hallucinations. He was hearing stuff about God telling him to quit his job and become a professional golfer. So yeah, no, you can see that he was already having some auditory hallucinations. If you hear some things that are not there and can't be heard by others, no, that's actually auditory hallucination. We have other hallucination types. We have visual, seeing things that are not there, tactile hallucinations, feeling things that are not there, no, olfactory hallucinations, meaning smelling things that are not there, and the most common actually is hearing things that are not there, which is auditory hallucination. Okay, he was preoccupied with his athletic and sexual accomplishments. Next po, he was oriented. Kindly read for me, Miss Naomi Ferrer. Miss Aubrey, Naomi Ferrer, Naomi Aubrey. Yes, sige, wala. Nathaniel Solis, sir.
He was oriented to time and place, but claimed he was the illegitimate son of Jack Nicklaus.
Okay, thank you. So ito, no, he knows the time. He was correct. He knows where he is. Okay, but he was claiming he was somebody else. All right. So as you can see at this point, merong psychosis, no? He was imagining things that are not there. He was thinking of himself as being a person he's not. Okay, so this is actually psychosis. And then next, Miss Ku. Risku. Okay. I hope I'm reading their names correctly. Okay. Sige. Si Miss Rose Valerie Manalo.
He was oriented to time and place, but claimed he denied suicidal and homicidal ideation.
Thank you. So he was asked if he was having some suicidal and homicidal ideation, and he said no. All right. Next, Miss Sofia San Jose.
He refused to participate in visual or memory-related portions of the examination.
Okay, thank you. Yun ang gusto ko, no? Pagkatawag, sagot agad. Yeah, very good. So, he refused to participate, okay, meaning he was uncooperative with the rest of the components of the MSE. Okay, finally, we have Miss China Gale Ugadan or Ugadan.
Mr. D was unreliable and exhibited poor judgment.
Okay, thank you so much. She has nice diction, no? Mr. D was unreliable and exhibited poor judgment. You cannot trust what he's saying, all right? And insight was absent. Okay, so students, when we say insight was absent, psychologically speaking, no, when it comes to psych, mahirap yung recovery nito, no? Yung prognosis na hindi ganun kadali. Because normally when there's lack of insight, you don't know or you fail to acknowledge what is wrong with you. So first off, you will start with educating the person what could be wrong with him or her. And once that happens, that could only be the start of, or that's the only time that the recovery and treatment would follow. Okay, because if they're not interested to know what's wrong with them, or if the facts offered to them and they're not accepting it, okay, then they won't be open to what comes next. okay, which is treatment and recovery. So I chose this sample, because this has something to do with the ER, no? At least for the nursing students here, no? Ayan, you could actually perform the MSE alongside the physical examination part. So even for those na RadTech and MedTech students, upon presentation of the patients to you, you can actually choose some of the components, try it, no, while they're doing or while you're conducting the procedures to them. You can actually check the mental soundness of the patient. Now, if the person is not, you can actually help or suggest for some other auxiliary services, so that, you know, the health of the person would be tackled holistically. It's not just one-sided. All right. So yeah, I think this would be the last slide before I say my thank you. Thank you very much. And I hope that you learned something from our really short discussion today. Thank you. Back to you po, Sir George. Thank you for the hearts, students.
Hey, magandang hapon ulit mga new students. No? So I would like to personally thank then Dr. Felisse. No? If for all of you who don't know her, si Dr. Felisse has a doctorate in psychology, but also at the same time, she's taking up pagiging doktor, medical doctor. No? Kaya siya talaga ang pinili namin dito, guys. So napakaswerte niya na si Dr. Felisse is a very young person. Nag-handle din yan sa aming school before ng student services, no? After me. Kaya we are very happy and fortunate, no, to be able to get her. Napaka-busy tao niya ni Dr. Felisse, no? Kahit alas 3 ng madaling araw, gising pa yan. Okay, so baka meron tayong iba mga just maybe 1 or 2 questions, no, from our participants today. I would also like to thank our participants, very active, no? Siyempre, they are also very interested in the topic. So baka meron po sa inyong gustong magtanong pa kay Dr. Felisse, no, sa ating topic ngayon. Oh, ano yun na, kasi si Dr. Felisse napaka-busy yan. Pwede nyo siyang i-add. Ganun yun, follow sa kanya social media. Okay, ayan si Miss Nicole. Miss Nicole, would you want to, maybe unmute and then ask this question yourself, no? Sige, Miss Nicole. Nako, mobile Facebook, medyo i-try mo nga ulit, Nicole, medyo hina yun. Because I can read from, sige, pwedeng i-try. The question here is if there are other affordable or even free mental health services. O ano ba ibig sabihin ng OT? Occupational therapy. Hindi ko alam.
I'm wondering too, Sir George, no, if she meant OT lang or like psych as a whole, other services related to mental concerns. But yes, no, there are not just affordable but also free mental health services being offered by institutions. Number one, siguro sabihin ko na yung alma mater natin, Dr. George. No?
Oh, yeah, of course.
Yeah, UST, the University of Santo Tomas, has the psychotrauma clinic.
Right.
So our own practitioners, our own professors there, and our own practicumers, no, PhD level, offer free services. Kailangan mo nga lang magpa-schedule. The Ateneo Graduate School, yung Bulatao clinic nila, they also offer free consultations for mental health concerns. If ever may kailangan na OT, i-refer ka na lang nila for the occupational therapy, no? And then, yeah, not to show you my colors for this coming election, but the Bayanihan e-consulta ni Madam Lenny, no, ni VP Lenny, they also offer free telehealth consultations. And yeah, merong mga may mga professionals who are really giving their time serving those who would like to consult. And one of the services they offer is actually the psych concern. Kasi nung nag-pandemic, spike di ba? Hanggang ngayon may spike ng anxiety and depression, to tell you honestly. Maraming nagpapacheck sa amin, nagwo-walk-in or referral, puro anxiety concern because of the pandemic, health anxiety man or social anxiety. Okay? So yan, meron tayong mga free. Meron po, affordable, hindi lang affordable, kundi free pa.
Ang question pala, Felisse, kasi nag-enter lang other than mental institute. Well, you answered it naman, no? Other than mental institute po. Yun yung kanyang,
okay.
Which is tama naman.
Yes. Yes. But if in case, sorry Sir George, isingit ko lang, no? If in case the services you need is not just limited to consultation, let's say it's something serious already, no? Like kailangan na ng institutionalization. Meron tayong National Center for Mental Health, and for those who are based in Cavite, meron din doon yung Cavite Center for Mental Health. Otherwise, yun, yung mga nabanggit ko po, pwede sila for possible or prospective patients. Yeah.
Sige. Actually, meron akong question kay Dr. Felisse. Pero sige, baka meron pa tayong mga students or participants here who, would want to ask some other questions. Thank you, Nicole. Thank you for that very beautiful question. Hindi ako sabihin yung wonderful, pang-English. Okay. Ako, Felisse, Dr. Felisse, ang aking tanong is, dun sa, may mga bata, kasi, first, ang aking pinanggagalingan, alam mo naman ang difference ng age natin, 2 dekada . So, ang tanong ko, siyempre yung older generations, parang, I don't know if we are in a state of denial or something, or maybe it's because of the times nga, as you said. Parang a lot of the people in the old generation, and not to demean ako, you know how I feel about the kids. Parang not naman to demean on the feelings of younger people. Some are thinking na parang bakit dati wala naman masyado yung mga depression, ganyan. And so, if you ask the older people, pag tinanong yung institutionalization, parang bakit baliw ba? Parang gano'n, no? Ayaw nila, very negative sila on those things . But apparently now, ako before, just to be honest, ganun din yung feeling ko . Siguro very short feeling for 4 or 5 years ago. But then I realized na hindi pala tama yung ganung attitude mo. Kasi, it's really not good, not kind of attitude. So what would you say about that feeling na parang adverse yung reaction nila into when you talk about institutionalization or something like that? What do you say about that?
Tama yung observation nyo, Dr. George, no? Actually, kinabahan ako sa tanong nyo. Akala ko stat . Okay. So, tama yung observation nyo na before, medyo iba yung reaction nila when it comes to psych services, mental health concerns. Kasi even until now, you could feel it, meron pa rin yung stigma, no? Yun yung mga bata na mapapunta lang sa guidance center, mapatawag lang ng guidance counselor, merong stigma kaagad na, you have done something wrong or there's something wrong with you. So how much more if it's to a psychologist or a psychiatrist, okay? But I think one of the reasons why people were more restricted before is number one, kakunti kasi yung mga diagnosis na available din before . Yung maraming mga sakit ngayon na ngayon lang na-discover just a few years back or ngayon lang naitama yung kanilang criteria, just like autism spectrum disorder, nito lang nung DSM-5 version, no, a few years back, saka lang sinabi na autism is not that you have it or not. Sometimes you fall in the spectrum. So that's actually one of the reasons why, no, limited yung diagnosis available before. And ngayon, mas open na because we see celebrities, we see popular people using their platforms properly, no, meaningfully, and they talk about what they experience. And it's good that it's being normalized now. Because mental health concerns, these are not something that you impose upon yourself. This is not something that you want, but you feel it. And it's not because of lack of faith. It's not just because mahina yung loob mo. Sometimes it can be explained with the biochemical things that we have inside that we don't really have control of. So hindi ka pwedeng sisihin if you're going through mental conditions just like that. Hindi siya kakulangan lang ng pananampalataya, hindi siya dahil mahina ka, no? There are things that you really can't control. Okay, so it's good that now we're becoming more open. We have these people who are talking about their experiences, rallying behind us, no? And aside from that, our government has become more open. We have the mental health bill that's been passed. Thanks to the of Senator Risa Ontiveros, no? Meron na tayong mental health bill, and because of that, more and more people are becoming more open to actually seeking help in case they need it, no? Wag tayong mahihiya in case we need to report we're feeling things like this. Wag nating intayin na it's too late, no? Nag-explode na tayo before we ever get to consult. And wag din nating tiisin na sa friends lang natin or sa mga kakilala lang natin because although they mean well, sometimes their skills and knowledge are limited and they can't offer you a third party kind of perspective. No, maganda may third party na objectively magtingin ng nararamdaman natin. Yan lang. Yan lang po, Sir George.
Tama yan, Dr. Felix. No? Kasi ikaw mismo, minsan in denial ka din sa sarili mo, no? Na talaga you need help. And kung totoo naman, kahit sobrang lakas ng ng tao, talagang there will come time na talagang sobrang puno ka na talaga. Hindi rin naman lack of faith or whatever because talagang dumarating na talaga yung point na yan. I love what you said about not only relying on your friends. So yun guys, no, huwag tayong na-realize ko yun dahil meron tayong na-experience na ganyan sa isang kakilala ko. Hindi pala talaga sapat na sinasabihan mo lang siya, okay lang yan, alam mo yun. Hindi pala talaga ganun, no? Kasi nga mayroong professional way of doing it and you cannot expect him or her, the same way ng perspective kasi in the first place, this person parang 20 years younger than you or something. So talagang ibang generation iba yung dinaanan niya, no? So talagang kailangan tayo rin naman while we say those things to our friends, lalo na our relatives, we are also, more or less open to, tama yung third party na medyo objective yung dating. Kasi lalo na pag parents yung kausap, no? Parents ng tao, parang minsan ayaw nila ng gastos lang yan, no? Mamaya, bakit ako naman, wala naman. Ganyan ang mga matutunda. So, so you really have to be aware that these things really occur. And if you need help, say it right away. Kahit pa paano, tama naman yan, open up ka with some of your friends. Pero be open for professional help. Tama yan. Okay, meron pa tayong ibang question dyan. No? Okay, parang naisip na question, Felisse. Yung derivative, hindi derivative, no? 5 kilos na ito. Then, yung Felisse, yung, this is something that I saw sa mga researches, no? Kasi this is something to do with us being preferred, no? Yung mga nurses, live ko na rin kanina to because of caring profession. When you talk about caring profession, parang doon talaga yung Filipino nurses, Filipino OTs, yung occupational therapy, PTs, diba? Even MLS. Pero at the same time, merong tinuturo kasi sa May ikaw lalo nagme-medicine ka ngayon, no? Na parang ayaw mo naman na magkaroon ng transference, no? Yung parang sobra kang ano sa touch ng mga patients, whatever. Kanina parang nabanggit mo yun eh. Can you realize kasi itong mga practitioners natin, eventually, nag-internship sila, tama ba? Parang alam ko, nag-internship sila eh. And it's easy to go both ways. Yung isa, sobrang aloof, dapat alisin ko yung sarili ko dito. Ayokong maging attached dito. Patient yan. On the other hand naman, yung sobrang dala ka ng damdamin mo, no? Talagang, lalo na pag nag-fail, di ba, ikaw eventually may doctor ka, no? Tapos not on my watch, tapos biglang may nangyari, wala na sana ako doon. Di ba, affected ka eh. Yun, maalis yun, right? So, can you at least briefly tell our, again, especially on those things? Kasi I think as a medical practitioner dito, you will see na hindi mo na maaalis talaga yung personality mo while you're doing the care profession. At the time yung feeling mo na, oh, I'm taking care of these people who are relatively unknown to me while my kids are in the Philippines, lalo na pag nagpunta sila sa ibang bansa, those things can bear down on you, right? Diba? So, can you more or less give a little insight on that before we go?
Sure, sir. Thank you for that, for that question. That's actually very timely. Lalo ngayon, ang daming lumilipad sa ibang bansa to care for people, no? Nung nag-pandemic, mas madami silang kinuha, especially nurses, no? Meron tayong kung tinatawag yung carers fatigue, okay? That you have been so open to caring for others, so sincere, but in the end, it's taking a toll on your psychological makeup, no? Sa yung psychological level. So, yun, iniiwasan din natin yun kasi later on, baka ikaw naman yung alagain, no? Yung magkaroon ng carers fatigue. Ang nagiging extreme consequence kasi ng carers fatigue, aside from physical and emotional exhaustion, sometimes you're overly desensitized, no? Pagka may nag-present sa iyo sa susunod na nakakaawa, hindi mo na ma-feel yung pagkaawa kasi overly desensitized ka na, wala nang effect sa iyo. Nakita mo na yung suffering. So that's what we're trying to avoid, really, no? So what we can do to avoid over-counter transference, sabi ni Sir George, no, very psych, no? May transference. Yung nafe-feel ng patient mo towards sa'yo as the practitioner, that's transference. And how you feel back towards your patient is what you call counter-transference, para hindi siya maging over at mag-cross ka na ng personal space. From the get-go, dapat naka-itemize sa'yo yung pwede mong panghimasukan sa buong patient mo at pwedeng hindi. If the patient is just asking for somebody to be there, no, yung nanghihingi lang ng support, presence mo, then feel free to give that. But if the patient is already asking for several advice, especially not related to, like, let's say the hospitalization part or the medication part, and it's about something personal, medyo be cautious, no? Kasi ba mamaya magbigay ka ng advice and it turned out the other way, babalkan ka niyan, ikaw pa yung masisi, no? So you have to put up healthy boundaries as to what you can do, what you can say to your patients, no? Sa akin, sana be careful in saying things, in doing things for them. At the end of the day, you're still the professional. Okay? It wouldn't also hurt if you would have your own carer or mentor. Kuha kayo ng ganun, no? Somebody you could speak with, na friend. Now, if need na meron ka ring professional help to actually debrief once in a while, it's not a sign of weakness if you're asking for help. Actually, the irony is, if you know when to ask for help, it's actually a sign of strength. So, as healthcare practitioners, very, very soon, no, maganda meron kayong mentor or meron kayong colleague na pwede mong paghingahan, pagkwentuhan ng iyong saloobin, ng iyong experiences sa hospital or sa diagnostic center before coming home, para hindi mo maiuwi yung stress sa family mo. Because that's what normally happens, na po-project mo, na uuwi mo sa bahay, and kung sino yung tatanggap ng stress mo, it's actually the people at home na pwede mong pakitaan ng ganong behavior. So kawawa naman sila, 'di ba? So distress first, don't bring them at home.
Oh, yeah. Oh, yeah, that's a wonderful advice, no? Pero guys, tama yung sinabi ni Dr. Felicia. Pero in the end, talagang on a patient to patient case talaga nangyayari sa atin. Eh. Of course, trust your heart. You know where you stand eh. Basta nasa gitna, basta alam mo yung values mo, core values mo. Wherever you go, alam mo what to do eh. Walang theory na makakapagsabi sa iyo that you're already over or medyo under. Follow your heart. Basta lang alam mo na tama yung pinupuntahan mo. Pero mas maganda talaga na, sabi nga ni Dr. Felice, if you have a mentor that will guide you, kasi sometimes you're so into the thick of the thing, and you don't know na sobra na pala ang iyong yung nga, word ni Dr. Felice, pakikialam. Di tama naman yun. Kasi ano nyo na guys na ano ko yung mga kwento sa yung kwento ng mga sa Hurricane Katrina dati yung talagang halos lahat ng mga doctors nag-uuwian na, and there was mga Filipino nurses yung mga naiiwan, they stay behind. Di ba? So parang makikita mo na everywhere, at least makikita mo na yung medical practitioners natin all over the world until now, we are still the go-to guys kasi nga of our big heart. No? So sana ang prayer ko lang is wag magbabago yun kasi syempre ang culture nagbabago yan eh. Depende sa hospital na pupuntahan mo, depende sa mga kind of people that you will interact with in the future. Pero yun nga, as I said, if you have your core values talagang nasa puso mo yan eh. It will guide you wherever you will go. No? So don't worry guys, you'll be in a good place. Kailangan lang talaga ay maging tayo centered yung ating ideas. No? You know that. So yun, I think Dr. Felice, do you have anything more additional words or whatever, mga final words natin sa ating mga students, no? Once upon a time, ganito ka din. Ikaw naman yung student before, no? Student leader, no? Ayun, tayo na nagsasalita sa kanila. So, yeah.
Yes, sir. Thank you. No? Una sa lahat, maraming salamat sa Innovizon, sa inyo ng team nyo for giving me this opportunity. If we want to send a message across kasi there's no better way than to speak with the youth, than to speak with the student. And this is the best population for that, no? Yung population ng mga estudyante. Sila yung mga mas matatalino at mas nag-iisip ngayon. No? So yeah, I'm thankful for this opportunity. Salamat sa cooperation nyo. Gaya ng nasabi ko, no? Walang masama if we need to ask for help. It's actually a sign of strength. So yeah, no, in case you think I could help, of course you can look for me even through Sir George, no. Just let us know how we can be of help to you so that we can ensure na your mental health is taken care of. Ayan. Tapos, wag natin pababayaang mag-suffer yung mental health natin because of some of the things, no, goals, ambitions that we would like to achieve. No? Kailangan we find that perfect balance of taking care of oneself and also going for the goals that we have set for ourselves. Kasi at the end of the day, if it is our mental health or even physical health that is suffering, wala din yung ating lahat ng pinagpapaguran. So, learn to distress once in a while. Pag feeling nyo pagod na, there's nothing wrong with taking a pause, trying to do things that you normally like, no? Trying to do things that you enjoy. You can do the Pomodoro technique, no? If halimbawa 20 minutes of reading, 20 minutes of reviewing, followed by 10 minutes or 5 minutes of break, that wouldn't hurt, no? Kesa yung tuloy-tuloy, in the end, mababangga ka sa pader. So it's okay, take your time while doing things and you can never go wrong. Ayan.
Yeah,
yun lang po, Dr. George.
Thank you very much. Baliktad pala ako. Ako pala ay 10 minutes of baliktad eh. 20 minutes of break ako and 10 minutes of work. Ngayon, at least nalaman ko yung tamang sequence. Okay guys, so maraming salamat in behalf of Innovizon Creative Solutions and Mag-ESI training. Of course, Dr. Felice, I think si Dr. Lea definitely meron siyang klase na siguro. And for all the participants who are here, siguro hihingi na lang tayo ng konting para lang ma-capture natin, no, yung ating mga participants. Can you, kung pwede lang, no? Pag hindi naman, we're not forcing you to open your cam. Just for documentation, guys. As dito yung mga names nyo kasi, no, guys, kasi kailangan namin to for our e-certificate. Can you, medyo pwede ba tayo mag-open cam, no, for just a bit? 1 minute window. First page po tayo. Kung pwede lang naman. Kung hindi, hindi. Okay. Yeah, I'm still waiting. Okay. Mukhang hindi nila gusto mag-open cam. Okay, so yeah, that's it. Thank you very much, guys, for attending. And Innovizon Creative Solutions is a company that does training in many fields, no? Particularly in finance and business, yung mga tungkol sa mga stock market and all that, patient safety, occupational safety and health, and sa iba pang bagay, no, in coordination with our partners, no, of course si Magezi and Dr. Felisse is always one of them. Thank you guys very much, and keep safe wherever you go, no, keep believing and keep being leveled on the ground, but reaching for the stars. Maraming salamat po, and keep safe po. Maraming salamat. Thank you. Ingat po kayo.
Thank you. Bye.
Bye. Kung po nangangailangan ng recording, I'll send it to your coordinators. Ask for them.